your head is too precious to be injured. Let's consider the situation when the horse has acute onset, severe lameness during or soon after exercise. What are the most common clinical scenarios? There could be severe unilateral or bilateral superficial digital flexor tendonitis. However, at the time of the acute injury, obvious swelling may not be apparent, and it's only in the following 24 to 48 hours that swelling might develop, as we see in the image on the right. Another cause of acute onset severe lameness during exercise is an injury of the accessory ligament of the deep digital flexor tendon, or the inferior check ligament. Usually swelling develops relatively rapidly within hours to 24 hours after sustaining the injury. I have encountered a number of horses which have had acute onset severe lameness associated with a complete tibial or radial fracture after a previous kick injury which had gone unrecognized. Relatively uncommon, but important to be aware of, particularly in horses engaged in sports with rapid turning, such as polo, are muscle tears. The most susceptible muscles being the pectoral muscles, adductor, and gracilis. And as I mentioned before, some of these horses may present with colic-like symptoms because of the severity of their pain. Hemarthrosis is a not uncommon cause of acute onset severe lameness associated with exercise. And the tarsocrural and the antebrachiocarpal and middle carpal joints seem to be the most susceptible. This may be a single episode event, or in some horses it is recurrent. It is usually associated with palpable distension of the joint capsule, and if a needle is placed into the joint, then frank blood will appear in the needle hub. If you drain blood from the joint by aspiration, then the lameness usually resolves very quickly. If left undrained, however, the lameness usually resolves spontaneously within 24 hours, in association with complete resolution of the distension of the joint capsule. So these can be challenging unless you see them at the time of the acute onset of lameness. If you were to examine such a joint ultrasonographically, you will see the image that we see on the left. So multiple white echoes within the normal anechogenic synovial fluid. This is absolutely typical of hemarthrosis. Acute onset severe lameness in a forelimb during exercise or immediately after exercise may be the result of a distal radial physeal exostosis or an osteochondroma impinging on the deep digital flexor tendon with or without creating hemorrhage into the carpal sheath. This is an 8-year-old warm blood dressage horse which has an episodic grade 6 out of 8 left forelimb lameness. There was mild distension of the carpal sheath. There was no resentment of carpal flexion when the horse was non-lame, but when, after short periods of exercise, lameness was induced, then there was, as you saw, resentment of flexion of the carpus. And on the right, we can see the associated radiographic image of a distal radial physeal exostosis. In a hind limb in particular, but occasionally in a forelimb, we can have arterial occlusion.